Sure. Back in March, when we first started seeing our first couple of COVID patients at the University of Kansas, we really tried to limit scanning these patients because we just didn't quite know what we had to do with the equipment afterwards, like how much did you have to clean it. And so just through that process, we've become more able to scan these patients, and the scanning of these patients have increased. One of the big complications that we see with a lot of these patients that have COVID-19 is essentially pulmonary thromboembolic disease. And so a sizable percentage of them will develop pulmonary emboli. And, at the start of the pandemic, we really tried to reduce how many CTAs that we did for pulmonary emboli. And we're seeing increasingly as these patients are sicker and sicker, they're in the hospital, the ICU beds longer and longer, they're going on to develop fibrotic lung disease as well. And with that, you start seeing the ventilator complications of pneumomediastinum, developing pneumothoraces. I've seen, I think I looked at 3 or 4 cases today that either developed pneumothoraces or pneumomediastinum just over the past couple of days. And so we're increasingly using imaging, advanced imaging, to really kind of guide, what's going on with these patients and hopefully guide treatment decisions. A large percentage of them will develop an organizing pneumonia pattern of lung injury related to COVID-19. And I think that pattern of disease, I know I've spoke with Chase about this, that, occasionally he may, do a different therapy because we see this pattern of disease. And so I think imaging has increasingly played a more important role, not so much in diagnosis, but mainly kind of managing the complications that we see with these patients.